We're at the International Conference on HIV and AIDS and IAS here in Vancouver. Beautiful, nice weather, Vancouver. And we're here with Chris Pilcher from UCSF. You're going to talk about, real briefly, because you have to catch a plane, but the essence of your subject, which is immediate treatment.
Right.
Tell us about that.
It's very clear from data presented at this conference, as well as in past conferences, that immediate antiretroviral therapy is indicated for all patients with an HIV infection, and that the earlier it can be delivered in infection, the better the outcomes for patients, both in terms of their own clinical outcomes, but also in terms of reducing transmission. So in San Francisco, at San Francisco General Hospital, which is a major public health clinic that serves a lot of medically underserved folks with HIV infection, we asked whether we could actually move to a model where we treated patients with beginning their antiretroviral therapy the day that they were referred from a testing site as being newly HIV positive. And it sounds simple, but it was not immediately apparent that this would be a successful strategy, because there are a lot of things that patients need in order to engage successfully in care, particularly in public health settings such as San Francisco General. So, patients need to be registered to insurance. They need to have their mental health and substance use needs assessed, and they need to be otherwise engaged in care, have labs drawn, all kinds of things that need to be attended to. So the idea of starting patients on antiretrovirals that same day was daunting and a real change in the way of doing things. But we decided in a pilot study that we called the RAPID program, as a team, as a clinic, we made the decision to try implementing this in the real world. And so we reported our results today in terms of how that was received by patients. And the main findings were that we offered same-day initiation to 39 out of 86 new patients who came into our clinic in a little over a year in our clinic. And this was all of the new patients with a brand new diagnosis of HIV who were referred.
It wasn't that they just acquired HIV, it's that they just were aware of it.
Just got their positive result.
Yeah. So they could have been infected for years or months or a day.
Right. In fact, though, when we looked, about half of the patients, 41% of all of the patients who came in, actually had a negative antibody test in their history within the past 6 months.
Okay.
So actually were very recent seroconverters, possibly acute infections. So in general, this is a very recently infected population.
Well, the reason they may come in is because they felt like maybe a viral spike, maybe.
Indeed, yeah. One of the reasons that patients may come in to test is because they're sick, or they feel like they may have a seroconversion illness. But frequently it's just because frequent testing of men who have sex with men has become the norm.
The norm, yeah.
And is really a pattern that it really encourages when people are diagnosed, that they're diagnosed early in infection. And of course, early infection is when infectivity is the highest, and we know that it's probably about 10 times more infectious during that first few months of infection compared with later. So the urgency of same-day treatment was really...
The viral set point would be different and so forth.
Viral set point may be affected, but everybody's viral set point will be undetectable if we get them on treatment.
Right.
So the goal is to get them on treatment during that highly infectious phase, get that down, and if we can get them identified and into care to treat them during the very early phases in the first few weeks after their acute infection, then we could actually potentially prevent some of the long-lived reservoirs of HIVs to be seeded, right?
So what was the upshot?
Sure. So the most important, two really key observations, in addition to the fact that it turned out it was safe and patients didn't really have any excess toxicity from taking the medicine on the same day before they got labs drawn. They seemed to do fine. In addition to that, we found that when 90% of the patients, 35 out of our 39 patients, when they were offered taking the pill, took it. And they took it on that same day. And the rest of them took it within the next week or two. So patients were very accepting and very enthusiastic about getting same-day treatment on the day they learned about their diagnosis. And
It seems as though in the old days, there was a huge stigma and huge drama that involved me. Oh my God, I'm positive.
Right.
Is there that still? I mean, there must be some of that.
Well, there
still.
Absolutely is that still, and I don't think that anybody, I've never, it's not typical for patients, even in this era where some people may talk about a sort of in a blasé manner about HIV infection. It's not typical for that this is a small deal. This is a big deal.
Even today.
It's a very traumatic experience. But one of the findings from this experience was that patients' reactions were really very positive to getting the treatment. Yeah.
Not only did they find out really bad news, but there's really something they can do right now.
And they
Maybe
left their
helpful.
first visit that first day to go home and tell their families potentially,
With a bag
or
full of
tell their
pills.
loved ones, being able to say, I'm on treatment.
Yeah, bingo.
And I'm being taken care of, and which is a qualitatively different thing. The other major finding from our initial experience was that the speed with which patients actually got virally suppressed and got undetectable was cut in half.
Wow.
From took about 4 months to 5 months before the institution of this protocol, but the patients who got this protocol in the last year or so in San Francisco were able to be all virally suppressed after an average of 56 days, which is remarkably quick after the first phone call to the clinic. So it's very gratifying.
Great news. I really appreciate you taking the time and not splitting on us because we were delayed in getting this started.
All right.
Thank you very
much.
much, Chris.
All right.
I appreciate it.
Thanks very much, Fred.